He didn't use these words, but I heard it this way, and he said, "You have cancer."
Mark's surgery was robotic-assisted laparoscopic partial nephrectomy.
Your life changes when you hear that. Your life, all of a sudden, it changes. You have two lives. You have your life before you've found out you have cancer, and your life afterwards, and it's a completely different perspective.
Means, in layman terms, removal of the kidney tumor without removing the whole kidney.
Christmas Eve morning, I said, what the heck, I might as well have this pain that had been nagging in my side checked out. Saw a physician's assistant at a walk-in clinic, and he asked me to get an ultrasound, called me after I left the clinic and asked for an ultrasound, and I almost shrugged it off, but then I went to get it anyway. Just the day after Christmas, got a call from the doctor at the urgent care clinic and said, I'd like you to come in to hear the results of your ultrasound. The ultrasound had shown a little bit of a mass on your kidney. We want you to get a CAT scan now. All of a sudden they're forced to face questions of mortality, questions about how much of a future you have, fears of what could happen were this cancer to not be treatable. And all those fears kind of swamped over me.
We start with general questions, trying to relax and then go to the problem. And the goal is to go home with a full understanding of what is going on.
And I came in to his office, and right away he set me at ease and said, well, you caught this pretty early. It's only 2.6 centimeters. Then began what I was to find is also part of the journey of somebody who has cancer. And the problem with cancer is that it's really part of you. It's your own cells having mutated, and so oftentimes your immune system doesn't see it as an invading enemy and attack it.
It's much easier for them to fight this disease if they know exactly what they have. I came here very late in 2011. Then with the help of Dr. Parik and Chris Tucci, Paul Ouellette, he's a physician assistant in the operating room with phenomenal skills. We succeeded to organize robotic surgery for approximately 20 new procedures.
Okay, yes.
Now when they put the camera in, I'll let you take a picture here. Fortunately, we have much more success than failures in fighting cancer today. It's very, very heartwarming when you see this patient that understood everything, and they see me 2 years out, and I said, I think you graduated. This is 2 years when majority of recurrences happens. There is no evidence of disease. Your next graduation is at 5 years, and after this, it's practically case reports.
But in the back of your mind, the nature of the disease is the fear of recurrence.
He has 98% chances that he is cured and long-term survivor of his kidney cancer.
This whole journey has been a series of being on the edge of cliffs, waiting for the next verdict on your prospects.
Negative margins, excellent oncological outcome, minimal blood loss and quick recovery after surgery, which is excellent, and functionally his kidney function preserved. It's the same as it was preoperatively.
The pain that got me first to go into the urgent care clinic, and it turns out has nothing to do with this malignant tumor. It turns out that indeed that pain came from a kidney stone.
I want my patients to have best possible outcomes. I want their families to get brothers, fathers, mothers back, sisters.
If it hadn't been for that, I would not have caught this. And in fact, they told me that in most cases where this kind of cancer, where many kind of cancers, but where kidney cancer in particular is caught early, it's caught incidentally, it's caught unexpectedly. And so I'm now a big fan of kidney stones.
Their outcomes is everything that I need. It's not my papers, it's not my numbers that are all important because it doesn't go one without other, but their recovery and their returning to their families, functioning and surviving this for a long time, that's the best thing that can happen.